Let's wrap up our first batch of things to watch for in the year ahead with the latest medical headlines, from vaccines to treatments, and the big question: could 2022 be the year that the pandemic finally ends? And for that, we say good morning to NBC's medical correspondent, Dr. Torres. Dr. John, good to see you in the flesh.
Good to see you as well.
So let's start there with that big question. I mean, it really is hard to believe that come March, that will mark 2 years since the World Health Organization declared the coronavirus a global pandemic. Is 2022 the year that it ends?
And it's been a completely bizarre 2 years that we've had here, that nothing any of us could have predicted. And my crystal ball is as foggy as any expert's crystal ball. But I think what we're going to see happening is not an automatic switch going on and off, where all of a sudden we're not in a pandemic next day. But instead what you're going to see is kind of a slow decline in cases happening around the world. You're going to see different areas declaring their emergencies being over. And then all of a sudden it's going to say, well, maybe we're not in this pandemic anymore. It's kind of a squishy topic and a squishy way to do that. But that's what we're going to happen. We're going to get an endemic virus, which means we're going to be living with it, not just this coming year, but years on. But I think it will end this year.
An endemic virus? Endemic. Explain what that is.
So that means basically, think of measles. It's endemic. It's always here. We control it with vaccines, but there are breakouts. And in those outbreaks that we have to walk in, we have to quarantine people, we have to vaccinate people to keep it under control.
Speaking of vaccinations, I mean, right now we're at a point where nearly 6 in 10 Americans are fully vaccinated. Where are we right now in terms of the fight? Shots in arms. Getting our arms around this disease.
So 2022, the word of the year is going to be boosters. And we're going to see booster shots throughout the year. The FDA has now authorized boosters 16 and above, recommended them for 18 and above. And remember, if you had an mRNA vaccine, 6 months after that, you're eligible for boosters. Johnson & Johnson vaccine 2 months later. Vaccines and boosters are the way we're going to control this pandemic, the way we're going to control the virus going forward. And we know they're not as effective as we like, especially the vaccines, but the boosters are bumping at that effectiveness. And we also know that even though they might not be effective or very effective at controlling the sniffles, in other words, us feeling bad, they're great at controlling the big three, which are serious illness, hospitalizations, and death. And at the end of the day, that's what we want. We want the vaccine to work to prevent those big three.
What about this magic pill that's in development here that should be getting FDA approval soon to treat coronavirus?
Right. There are a couple pills out there that the FDA is looking at, and they're going to decide what to do. One of them is from Merck, one of them is from Pfizer. Those pills are great if they're taken early. Have you ever had Tamiflu for the flu?
I actually have.
Yeah, and so you have to get tested. You have to be early, a few days in, and then it works. Same with these pills. So it's another tool in our tool bag. Goes along with the vaccines, which is the biggest tool. But we need all of these: convalescent plasma, these pills, the vaccines to control the pandemic. Not one is going to do it, and that's something we found out over the last couple of years.
Let's talk about the flu really quickly. Of course, last year, due in part, I would imagine, because everyone was wearing masks and we really weren't out and about a great deal, we saw a flu season that was pretty mild comparatively. What are we thinking about this flu season?
And I'd call it a strange flu year last year, because every doctor I talked to said the same thing. They're like, this is we've never seen this. We never thought we would see this. But no patients in the ER, no real problems with the flu last year, because we were wearing masks, we were socially distanced, and importantly, kids were not in school.
Right.
Kids are a big spreader of the flu. They're back in school. We're not wearing masks as much. We're not socially distancing as much. And so the concern is this is going to be a big flu year. So you need to get your flu vaccine now. Much like the COVID vaccine, it takes 2 weeks to take effect. It's not the most effective vaccine out there, but it does help prevent those hospitalizations and deaths, which at the end of the day we want. And the important thing is the flu vaccine is not going to do anything to protect you from COVID itself. But if your immune system stays strong by not getting the flu, then it can fight off COVID as well as best it can. So it does help in the long run.
That's a really good point. Dr. John, good to see you.
Good to see you, too.
Happy New Year
Happy
to you
New
as
Year.
well, sir.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.